You're just going to need to accept it. So if you could, in the chat, start typing in just your name, your organization, just think really quickly about a network that has been especially meaningful to you, because today we're talking about networks. I just want to get everybody thinking in networked ways. We had a partner convening back in March, and if you didn't attend that, I'm going to drop a link in the chat for you in case you want to go watch this on your spare time with some snacks. You can watch it anytime. This was our recording where Visible Network Labs joined us when we were thinking about doing a network analysis. We hadn't quite done it yet. So today we are on the other side. We completed things, we learned things, and the VNL team is going to be sharing some of the results with you. And we encourage you to ask lots of questions. So this is a little outline of what we've got in store. The first hour, I'm just gonna quickly provide a little background of why we got interested in this. Then Visible Network Labs is going to present their findings, and then we're going to have open discussion and Q&A. And Amanda, I don't know, I'm assuming we can also have that happen through the course of your presentation, right? It can be kind of organic. And then if anybody's dying to ask additional questions that they didn't get to, or you have a really specific interest, you're welcome to hang on from noon to 12:30. That's totally optional. We're just going to keep the room open for anybody who's interested. And if nobody is, if everybody's hungry, then we'll just end it at noon. So that's kind of what we have in store. Really quickly too, I wanted to reiterate why we're talking about this today. So earlier this year in March, we talked about, actually throughout the beginning of the year, we talked a lot about distributed leadership in our partner convenings. And for me, this is where making sense of our network is really important. And we kind of got introduced to network analysis through an evaluation of ACHs in Washington and California. And actually, I believe Stephanie Bultema is joining us today, which is exciting because that's how I learned about this and that's how I got connected to VNL. But this slide that you see here, that complex little picture on the right-hand side, that's actually represents part of our North Central ACH network. It was just kind of a glimpse of what we might get, what kind of data we might get from network analysis. And for me, just that image, even though you can't see all the detail, it just underscores why we need to just embrace the fact that we do operate in distributed ways. There is distributed leadership and action across our region. So it's already happening, and how do we invest in that and then work better as a network? So this got me really intrigued, and I'll share some of the questions that I was asking myself and that we as an ACH are asking ourselves all the time, right? Like, who are our partners? Who are our partners' partners, right? There's some folks that we may not be working with that maybe we should be. Are we helping create or maintain inter-organizational relationships, cross-sector collaborations? Are we bridging silos, decreasing them, or are we adding to them? Are we helping build capacity where there's like needs and gaps, like there's holes in our networks? You can see a little bit in the next 5 bullets that this is something we really care about as an ACH, is increasing connections and trust and collaboration and coordination. And so network analysis in some ways helps us see whether we're actually doing that. A few more questions that we've been curious about is, are all the entities that appear in our network analysis engaged with the ACH network? And if they're not, should they be? If there's holes, how do we build new nodes? And Amanda will let you know what we mean by nodes if that doesn't already make sense. And then can we facilitate missing linkages, right? The lines that you're going to see soon in the presentation. So this is just some background, the questions that we've been thinking through and that we hope to gain some insights on. And let me just tell you that this network analysis is not going to answer all these questions. I've already talked to Amanda and the VNL team, and in some ways you get even more questions, but I think it can help us start to play around with the data and make sense of it together. to have really good conversations about how are we going to work differently together? How might we work differently together? So, with that, I'm going to stop sharing my screen and I'm going to turn it over to Amanda. And I really do encourage all of you to unmute at any time and speak up with your questions or insights, or feel free to use the chat box. I'll be keeping an eye on it, and I asked the ACH team to help me with that too. So, Amanda, it's all you.
All right. Apologies, everyone, for the technical difficulties, and thanks for your patience.
No worries, Amanda. I don't know if you heard me, but we're used to this in the North Central region. So we solved it and we're ready to keep going.
All right. So again, thanks for having us. I'm here with my colleague, Elena Leidy, and also very instrumental in this work is my other colleague, Kaylee Baczynski. So wanted to acknowledge both of them. So let me start out by just giving you a little background about how we collected these data. We sent a survey to 178 stakeholders whom NCACH identified for us in April of 2022. And our response rate was about 61% overall. We did have a drop off toward the end of the survey. So it went down to about 40% when you got to the final set of questions. But overall, this is a really good response rate for this type of survey. We had a couple of key questions. Caroline elaborated on a number of them in the introduction. The ones that I'm going to focus on for this presentation are around how stakeholders currently are working together, who are the key linkages across organizations, does the current network structure really reflect a distributed leadership model, and then what is the impact of the network on the community? Let me just give you a little bit of a picture of the composition of the network as reflected in the survey respondents. Primarily, we had nonprofit organizations and government agencies who responded to the survey, although there were some coalitions also represented, some philanthropic organizations, and then businesses or for-profit organizations. In addition to the 178 organizations and tribal representatives that were identified for participation in the survey, the respondents also wrote in 140 additional organizations into the survey whom they felt were important partners in their work around improving health and well-being in the North Central region. So in addition to the 178 organizations that were originally identified, 140 additional organizations were identified by those asked to complete the survey. So overall, quite a large network that we were able to capture. We also took a look at the breakdown of different types of organizations by county, and of the organizations that responded to the survey, more operated in a couple of the counties. You can take a look at these county subtotals at the bottom of the table here to see sort of the distribution of organizations across counties. So let's now talk about the network map and what that looks like. In network science, we like to map networks of organizations and people by representing those organizations or people as circles. And so that's what you're seeing here. All of these circles are depicting organizations or tribes in the region. And then the light gray lines that you see between all of the circles are the relationships that these organizations reported having with one another. And we do a couple of things to sort of further illustrate what's happening in the network. The first is that we color code all of the circles by the organizational sector that those organizations are representing. So you'll see a key up here at the top of the map showing that for-profit organizations are this blue or teal color, coalitions are orange, government organizations are purple, nonprofit organizations are light green, and then philanthropies are sort of the darker pink. In addition to color coding, we also size the organizations by the number of relationships that they report having. So organizations that are slightly larger are those that have relatively more connections than their colleagues. And we can take a sort of a closer view of the map here by zooming in on this central portion. And what we've done here in this view is circled in red key players in the network. And here we're defining key players by the number of connections that they have. So again, those organizations that are connected to proportionally more of their colleagues are those that are circled red. And I've listed them out here in this table on the right. So some of these key players are Action Health Partners, the Shellon Douglas Health District, NCACH, SkillSource, Molina Healthcare, Rural Resources, and Okanagan County Community Action Council. And we can really think about these organizations who've been identified as particularly active key players in the network as those that if they suddenly left the network, a lot of connections would be lost. So they're playing an important role in the network.
Amanda, can I just insert a quick bit of information here for any of you that are looking at this and wondering like, oh my gosh, this is so overwhelming. How do I tell these lines apart or even what those labels correspond to? So know that there's a platform, actually it's called the partner platform, that has this data in it where you can actually go interact with it and zoom in on things, filter things. So if you're having any questions about what's what, like we do have the data that we can explore together down the road. I don't want you to think that these static maps are all that we have to make sense of our network.
Thanks, Caroline. So I want to just go ahead and give you one last look at the network map here. If you take a look at the overall picture of the network here, it's in a very sort of typical structure that we see across a lot of the community networks that we work with. And that's what's called in network science a core periphery network. And what that simply means is that there's a core of very active organizations in the center of the network that are highly connected with their colleagues. And then on the periphery, there's organizations that are slightly less well connected. And I like to think about the sort of the core versus the periphery positions in a network as being equally important. So the organizations in the core are the ones that are really focused on this network's mission and really active in trying to meet the goals of the network. The organizations that are on the periphery are still engaged in the mission and active, but they may be more connected to other networks or other stakeholders in the community. They may be organizations that are focused more on different social change missions or objectives. And they're equally important to those very active organizations in the center because they are connecting the network to people and voices and stakeholders that may otherwise not be connected or represented in the network. So both those folks who are in the center and are highly active in the network and those that are on the periphery play really important roles in the overall network function. And you see this sort of structure across a lot of community networks. And so this is what the network looks like in North Central Washington at this time. And we can compare it to some of the other recent community networks that Visible Network Labs has worked with to map. And so all of these that I'm showing here are other health and social service networks that we've worked with recently. You'll see that they all have sort of this core periphery structure where there's more activity in the center of the network, and then less well-connected organizations on the periphery or the edges of the network. One of the things, though, that I want to emphasize here is that in comparing these other community networks to the North Central Washington network, you do see some differences. And one of the things that is striking to me about the North Central network is that there really aren't a lot of differences in size between all of the organizations, meaning that, yes, there are some larger organizations, meaning more well-connected organizations, but there's not a lot of big size differences. And you see in some of these networks that there are some very large organizations that are much larger than their colleagues. And when you see a network where there aren't a lot of size differences, or there aren't a lot of dramatic differences in terms of the numbers of organizations that members are connecting with, what that means is that you have a network where you're really seeing a true distributed leadership model. So in networks where the leadership isn't as distributed, for example, in this network on the left or the network on the far right, you do see organizations that are a lot larger than their peers, meaning that they are really taking a much more active role and are much more well connected than some of their colleagues in the network, and thus are likely playing more of a leadership role than others. But in the North Central Washington network, you really don't see that big difference in the sizes of the organizations. So that's one thing that I took away from looking at this network structure. The other thing that I want to emphasize, and you can see this in the color coding and sort of the distribution of the different colors throughout the network, is that this is really a truly multi-sector or cross-sector network where you have a lot of true multi-sector partnering happening. Sometimes you'll see in community networks there's a clustering of one particular type of organization, and you see that here on the far right network because you see a lot of clustering of the green organizations. And that's indicating that there's a preference for certain types of organizations to work with other similar organizations to them. You're really not seeing that much in the North Central Washington network. The sort of sectors are very well dispersed equally throughout the network. And that's just an indicator to me that there's a lot of cross-sector collaboration going on. There's not siloing by sector throughout the network. And then I just want to emphasize that if you look at this North Central Washington network, the core of the network where there's a lot of highly connected organizations is quite large. And that's telling me just that there's a high proportion of network members who are really very engaged in the work of the network. And sometimes you'll see networks, for example, this one on the far left, where that core is slightly smaller and the periphery is larger. So I hope comparing North Central Washington and its network structure to some other community networks sort of gives you a sense of how the North Central Washington network may be unique and what some of its strengths are. Moving away from the network maps to other types of data that we collected in the survey about the relationships in the network, we asked people about how frequently they worked with their partners in the network, and the most common responses were either once a month or once a quarter. So people are working with their partners regularly, but not every day as a norm. We also asked respondents to report on the types of activities they were doing with their partners in the network, and the most common activities cited were the exchange of general information and resources. Almost 70% of the reported partnerships were doing that kind of activity. And then resource referral or service referral was sort of the second most common type of activity. So a lot of referrals happening within partners in the network. We asked people about the degree of collaboration intensity that was happening in their partnerships with other network members. And we measured this on a 4-point scale from awareness to integration, with the awareness level indicating that partners were aware of one another and had an understanding of maybe what their partner did and some of their programmatic activities, but weren't really partnering with them on joint activities. And then on the other end of the spectrum, the integrated level of collaboration referred to partners who actually had formal contracts with one another and were really working very closely together on related content areas. And so what we saw in this network is that the most sort of common level of collaboration was integration at 30%, but the other levels of collaboration were also pretty well represented. So there was a nice distribution of the different types of collaboration throughout the network. That's generally what we're looking for as a sign of health in networks. If you had, for example, a network where there was like 50% of the relationships at the awareness level, that would indicate that the network was really not leveraging its collaborative advantage. On the other hand, if you had 50% of relationships at the integrated level, you might start to worry about the potential for partners to sort of burn out on collaborative activities and for the sort of level of collaboration that was happening in the network to not be sustainable over a long period of time. We broke this level of collaboration intensity out by county, and so you'll see you have here at the top again what we saw on average across the entire network. And then for each of the counties represented in the network, we have a breakdown of the collaborative intensity across those counties. And really what you're seeing here is, in general, the level of collaboration across all counties was pretty similar. You see here at the second row, there is a little bit of a difference in Chalon County, and apologies if I'm mispronouncing that county name. So you have a little bit more of partnerships being reported at the awareness level, whereas in Grant County, you have a few more partnerships being reported at the integration level. But in general, there's a lot of uniformity across the counties. So you're not seeing sort of a big difference in terms of how intensely different county organizations are collaborating with one another. We also asked all of the respondents to the survey to report on their perceptions of their partners according to trust, how they trusted their partners, and also how they valued their partners. And I'll start first with the trust scores. We measure collaborative trust on three dimensions. So we look at how partners rate their reliability, how they rate the degree to which their partners are supporting the network mission, and then the degree to which their partners are open to discussion. And so you'll see here in this graph that we measured all of these dimensions on a 4-point scale, with 4 being high trust and 1 being low trust. We generally consider scores over 3 to be quite positive. And so you'll see kind of across the board on all of these dimensions of trust, network partners really rated their fellow members quite highly. And no big differences across the 3 dimensions either. In terms of value, the scores are slightly lower. So you'll see in the chart, again, we measured the perceptions of value on 3 different dimensions, and those are power and influence, level of involvement, and then resource contribution. What we're trying to do here is really just capture the fact that different types of organizations can contribute different forms of value to their partners. We generally see organizations that are government agencies or have some regulatory authority, as well as organizations that have funding that they can distribute to be rated as higher in the power and influence dimension, and then organizations that don't necessarily have those resources, but maybe highly involved in the mission of the network, or have a lot of resources to contribute to rate more highly on those dimensions. And we see here, like I said, the value scores are slightly lower than the trust scores. That's a pretty typical finding across all of our community networks, but still they're just right below the 3-point mark, so still a relatively high. I want to just now show the value and trust scores broken out by different counties. And really here you see each county has a different color coding, but you'll see that the bars representing each county are pretty similar levels across all of the counties. So there's not a lot of differences in terms of trust and value ratings across all of the counties. When we break out the trust and value scores by organizational sector, however, you do start to see some interesting differences. And here what we've done is we've color-coded the different sectors in the same way that they were color-coded on the network map. So the light blue color is representing for-profit organizations, orange is representing coalitions, purple is representing government agencies, green is representing nonprofit organizations, and then philanthropic organizations are that pink color. And then we have a baseline score in the dark blue or black that is showing the average across all of the sectors. And here I want to point out a couple of differences that we see across the sectors in terms of the trust and value scores. First of all, the philanthropic organizations are particularly highly valued and highly trusted. Those are the pink bars across all of the charts. Coalitions in orange are seen as being, for example, very highly involved in the work of the network, but not as powerful and influential. And then in contrast, the government agencies represented in purple are seen as having power and influence, but not as involved and not contributing as many resources. In terms of the trust scores, they were a little bit lower for the for-profit organizations represented in light blue, and also for government agencies. So some variation in terms of trust and value by sector, and these differences are distinctions that members of the network can talk about and sort of make sense of together, and representatives from these different sectors can potentially think about why some of these differences are being detected. I want to talk a little bit about some of the data that we collected about the network's impact on the community. We were able to ask about, for each respondent, which vital conditions they feel their organization is able to influence, or that their organization tries to influence. About 70% of respondents identified working on basic needs for health and safety in the community. And then the next highest vital condition was lifelong learning. The least common vital conditions being addressed by organizations in the network were promoting a thriving natural world and addressing the need for reliable transportation. We also asked respondents to identify contributions of resources that they feel their organization could make to the network. And we actually created a little directory of these resources by organization, so that hopefully that directory can be used by network members to identify potential partners who have resources that may be in need or may be of interest to them. We've put in the red box the resources that at least 50% or more of respondents said that they could contribute to the network. And so these really commonly cited resources were community engagement, partner connections and networking, advocacy, and training and education. One of the things that we saw in, if we go back to these trust and value scores, and let me just go, to this particular slide, we saw that relative to the other dimensions of value, the resource contributions dimension was a little bit lower than the rest. And so that may be an area that the network could target for some intervention and action. We're hoping that the resource directory that we created in our reports provided to NCACH could potentially assist with that. That may also be influenced by the fact that many of the respondents may have thought about funding when they answered their resource contribution question. But we know that staff time is also a very valuable resource, and that's certainly reflected in some of the answers here to the question about resource contributions. I just want to wrap up by talking about some of the ways that members of the network can think about these results and potentially use them for action steps going forward. Looking at the overall network map and the distribution of relationships and activity throughout the network. As I mentioned before, we see a very distributed leadership structure where there's no one particular organization that is a lot more powerful or influential than the others. So that's really a strength that I think that the network can build on, and certainly something to try to maintain going forward in the network. Another thing to think about and consider is how the network partners said they connected with one another, what types of activities that they said that they were doing, and whether there are some activities that the network might want to foster more of throughout its membership. There's also some thought and consideration that could be given to the sectors and types of organizations that are distributed throughout the network. One of the things that I pointed out earlier in the presentation was the fact that you didn't see a lot of clustering or siloing by sector, which is really a strength, I think, in this network. But one of the things that we did note was that while philanthropic organizations were really valued and trusted in the network, there weren't very many of them. And so it's possible that if there are other philanthropic organizations in the region, that they could be brought into the network, and that would be of value to other members. A couple of other things to think about: the distribution in the level of collaborative intensity across relationships in the network was at a pretty healthy level, but we did see that about 17% of relationships were at awareness, and there was about 30% at the integrated, at the opposite high level of collaborative intensity. And so you might consider how to reduce further the number of partners who aren't very aware of and aren't collaborating much with their partners. And then conversely, also just consider whether there are some partnerships that might be operating at a very collaborative level, but might not be sustainable in the long term. And then, as I was just discussing, I think overall the levels of value and trust in the network are quite high, and are definitely a strength, again, for the network to build on. But we did see some variations across the sector, and those variations are something that network members might want to discuss and sort of make sense of and think about whether there are any opportunities for action or improvement there. I'm going to pause now and ask if there are questions or things that people wanted a little bit more information or detail on. And you can feel free to just unmute or to put a question in the chat if you prefer that.
Amanda, this is John Chapman. I can't remember if we saw, was there a sense of the number of agencies that responded per county? So if we know if our network was pretty distributed across the whole region or if it was focused in one specific geographic area?
I don't know if we looked at that or not, but we could definitely take a closer look to see if there was any sort of disproportionate response rate across county.
Hi, Amanda. This is Wendy Bresney from the North Central ACH, and thank you for this presentation. It was very interesting and gives a lot of food for thought. I'm curious on how our clinical organizations, both physical and behavioral health, how are they classified under your different categories?
Yeah, so I actually, I'd love to defer to Caroline here. Let me go back to my slides also and just take a look at these different sector categories.
And I actually think, Amanda, that in your slides, there wasn't a breakout of organizations by field. So Wendy, we did ask what
Right.
fields they work directly in, and they could select all that applies. So there was one option for healthcare, one option for mental health, and also an option for chemical dependency and SUD. So it's possible to look at that network and filter for those three, and then you would see the network that that you're asking about, and you could go dig in.
Yeah, and I can just show a quick snapshot here. This is in the report that we provided to NCACH, and this breaks out the organization's field of work. So you see there's a little over a third of respondents were working in education. Another little over a third were working in healthcare, a little bit less than a third in mental health. People could select more than one field, so this is going to add up to over 100%. But we wanted to do that so that organizations that were really addressing multiple areas could accurately represent themselves. So that gives you a little bit of a picture of how the distribution went. And then as Caroline mentioned, on our platform, you can further filter by these different areas to really see if there's differences in terms of how for example, healthcare organizations were interacting with education organizations. Other questions?
Thank you.
Yeah, great question.
Looks like we might not have any questions. I did want to share that after today's webinar, I'll email everybody who registered, and I'll include a copy of the full report that you saw a couple screenshots of, the recording from today, also the recording from the March webinar, and that way you can kind of dig into this stuff on your own time. And back to the next steps that Amanda alluded to, we are definitely planning as an ACH of taking this data and starting to have some conversations and dialogue with partners to make sense of it together, and also talk about what it could mean for partnerships to grow, or ways to have less redundant meetings. I've heard that across our network a number of times, like feel like we're going to the same meetings and then same networking functions, and they feel duplicative, right? So I think this gives us more granular insights about how we're connected, and we can start to look at, the behavioral health network, or we can reach out to the recovery coalition and show them the recovery organizations and have conversations about what that means for them, or the coalitions for health improvement in each of our regions, Okanagan, Grant, and Chelan Douglas, right? So we can show them maps of their network. Same with Our Valley, Our Future. We can show them maps specific to Chelan Douglas agencies that are working on belonging and inclusion, right? Because there's some efforts right now that are emerging around that. So we're really wanting to apply this data and share it with partners through conversation, and help it kind of like guide our investments together. So stay tuned for that. And if you have specific requests, feel free to reach out to me and I can help dig into it. Another quick thing I wanted to mention is that if any of you on the call today actually did complete the survey, you will get a profile of your organizational level results, and that's going to go out on Monday, I believe, Monday or Tuesday. So look out for that. And Amanda, I see that you have your hand up.
Yeah, thank you. I just saw Summer's question in the chat, which is, how have you seen communities collectively discuss, understand, and begin applying all of this data? Yeah, great question. And I'll just briefly add to what Caroline said. One of the, there's a couple ways that I've really seen members of networks engage with this type of data effectively. The first thing is everyone always wants to immediately take a look at the network maps, the visualization with the circles and the lines that I showed all of you at the beginning, and find themselves in that map, and then find other organizations that they work with closely and decide for themselves whether that's really an accurate rendering of how they collaborate with their partners or not. And so I always encourage that as sort of a first exercise in looking over these data as a group. It's really fun to see where you are visually in this network, and then decide for yourselves whether you think this is an accurate representation, or maybe because some of your key partners didn't respond to the survey, or for some other reason you don't think it's quite right, talking about that if that's the case. But then also really thinking about some of the other questions and data points from the survey, again, around differences between the different types of organizations, or potentially thinking about organizations that are not well represented in the network, or are less well connected in the network, and thinking about whether that represents something that is good and should continue, or is something that the network might want to change. Another thing to do is to look at the stated goals of the network, and the objectives that the network wants to achieve, and then look at, again, some of the data points in the survey, and see if the data from the survey indicates that those goals and objectives of the network are being met, or if maybe there are some areas that should be focused on going forward. Those are some of the ways to think about the data. I want to leave all of you, with a couple of final thoughts. One is, this is just a sort of a baseline picture of what's happening in your network. Caroline and her team at NCACH worked with our team at Visible Network Labs quite a bit to think about who to distribute the survey to, and we took a very sort of broad and inclusive approach to who the survey went out to. But despite that, we still had respondents writing in 140 additional partners who they thought were really important to that work. So this just captures sort of an initial snapshot, and taking another look at the network in a couple of years would allow you to see how it's growing and changing, and if it's growing and changing in the way that you want it to. And the second thought that I want to leave you with is just, again, that overall, the sort of key indicators that we look at to demonstrate network health indicate to us at Visible Network Labs from very much our outsider perspective. So keep in mind that we're just looking at these data from a network science perspective, and don't have all of the insights and experience that you do in working with your community. But from our perspective, a lot of these indicators that we were measuring through the survey suggest to us a very healthy network, and very healthy levels of collaboration happening throughout the network. So I think that's really something for all members to feel good about. And obviously, there's always room to strengthen the network and to improve, but you're starting with a very strong foundation for future work. I'll hand it back to you, Caroline.
Yeah, thanks for that, Amanda. And Summer, I think that contextualizing of data that Amanda just alluded to is like probably the most important part of this data, and making sense of it together in conversation and as we plan going forward. So that is going to be the fun part, actually applying the data, not just having this kind of static snapshot report. And there's also some couple things that I wanted to call out that are on my mind. One is that some entities that I know are really important on our network just didn't have time to complete the survey. So I'm kind of wondering and playing around with, like, how do you add to the network data like on a continual basis, so that it's not just done once a year, like, and so that the people that we missed this time around can be included somehow, folded into the analysis. So that's one thing. And then the other is that I think that I would love to be able to have a external facing dashboard of this data for our partners to explore on their own. I know VNL is working on things, but it's under development, and I don't know what their timelines are, and they have all sorts of other things they're juggling. So if doesn't, if that's not an option through VNL in the near future, I have a couple other ideas of how we could make the data more shareable, because at this stage, to share the data would mean that we give, like, there's no segmenting of permissions to the data, and that's a problem. So I am motivated to move that way, and in the distributed leadership spirit, put that information in the hands of our network, and also let people self-organize around discussing, understanding, and applying the data. So stay tuned for that. And I think at this point, we're going to stop the recording, call it a wrap for the webinar portion. But any of you that want to just hang on, turn your videos back on, and then off the official meeting, just have additional questions you want to ask or explore, feel free to hang on. And if you want to go get lunch and nobody hangs on, then we're all going to just sign off. So at this point, I'll just stop the recording, and thanks for joining us, and stay in touch. Open to all your questions.